All right, a very good morning to you. It's good to see you right here on Your World. Happy New Month. It is the first day of October, and today on the show, being a Wednesday, as you all know, it's Wellness Wednesday. And the conversation today being October, we'll be focusing on breast cancer because October is Breast Cancer Awareness Month. And we have an oncologist, we have a patient, and we have a survivor here on set today to help us really understand, first of all, the burden of breast cancer, not just here in the country, but also across the globe. And what is it that we need to do different in terms of support, in terms of treatment, in terms of attitude as well, as far as cancer is concerned. Because this year, the theme for breast cancer is every story is unique and every journey matters, okay? And just in case you're like, what happens during Breast Cancer Awareness Month? Well, this is a time to create awareness on the millions of lives affected by breast cancer and reaffirm the global commitment to equitable access to care and improved survival for all. So how are we doing as a country? How are we doing as a people? Well, that is what we'll be focusing here today on the show. So be sure to stick around until the end. And my guests are already here. Like I said, we have an oncologist, we have a patient, and we also have a survivor. But before you meet them, the question that we're asking you this morning is, if you could send one message to every man or woman out there about breast health, what would it be? Okay? If you could send one message to every man or every woman out there about breast health, what would it be? We'll be looking at your feedback as we continue with the conversation. And you know the drill by now, at NTV Kenya across all board is how you can reach us. But to introduce my guest this morning, and starting on my immediate left, as per usual, we have Rachel Nyokabi Kariuki, who is a breast cancer patient. And Rachel, thank you so much for coming by today. How are you? Unasikiaje? How are you feeling this new month?
Nashukuru Mungu. Nimetoka matibabu ya radiotherapy. The Nairobi Hospital.
Yeah.
Nimeshukuru sababu nimefanya yangu ya 7. Yeah. So, Rachel Nyokabi Kariuki, na nimepambana na ugonjwa wa saratani kwa muda mrefu. Kuanzia 2021 na mpaka saa hizi naendelea na matibabu.
We'll come back to you to jue, first of all, hata ilianzaje, because most of the time when you speak to women about breast cancer, watasema, hey, mimi hata sikuwa najua. I felt something, nikafikiri, itapotea tu. And then with time, unaenda hospitali unaambiwa, oh no, actually he knew breast cancer. So we'll want to understand your journey up until now, imekuwaje, because, and first of all, just thank you. Umetoka hospitali and you're here.
Ndiyo.
Thank you.
Ndiyo.
Asante. Asante sana, Rachel. Asante.
Yeah,
and how are you feeling? Are you?
Niko sawa kabisa.
Uko sawa.
Niko sawa kabisa. Okay. Nilimaliziwa mapema by 6:40.
Okay.
Nilirauka asubuhi sana, manake huko wanarauka asubuhi sana.
Oh wow.
Yeah.
Okay. But thank you. If you need anything, tuambie tu. If you need some water, something, just let us know, okay?
Yeah.
All right. And then next to Rachel, we have Dr. Lalit. I am trying to pronounce the second one. Please help, Doc.
It's okay. So hello everybody. A pleasure to be here.
Thank you.
I am Dr. Lalit Barad Pandey, medical oncologist with RFH Cancer Center, which is at Ruai on Kongundo Road.
Fantastic.
It's a pleasure to be here with all of you.
Thank you. Thank you so much for making the time to join us on this very important conversation. And next to Dr. Lalit, we have Nana Kilemi, who's a breast cancer survivor and a caregiver as well. Thank you so much for making the time. How are you doing?
I'm fine, thank you. Hello, everyone. Good morning. Happy New Month. My name is Nana Kilemi. I'm a breast cancer survivor, now 3 years in remission.
Oh, wow.
I'm also a founder of an organization. That's why she's calling me a caregiver. Of an organization which caters for very vulnerable cancer patients. It's called Needy Cancer Health Initiative.
Okay.
Whereby we help extremely vulnerable cancer patients take care of their medical bills. We give them food. We give breast prosthesis.
Oh, wow. Okay.
Advocacy, a lot of advocacy on preventive measures, and we also do livelihood programs. For the ones who are in remission, we get them jobs, we start for them small businesses, and I also work. I have a 8-5.
Oh, wow.
Yes.
Okay.
I work
all
at
those things,
yes.
but also supporting cancer.
I also work at the
patients.
Nairobi West Hospital.
All right.
At the Cancer Center.
Oh, fantastic.
Yeah, at
thank
Nairobi
you.
West.
And thank you so much for making the time as
No
well.
problem.
Yeah. And Doc, can we just start with you? Because when we talk about cancer, we've had conversations about cancer for a very long time, but still it's either it's not either well understood, or there's a bit of, hesitation. For even women, you talk to them and say, hey, listen, sometimes it's important to just go to the hospital and get checked, and some tell you, no. What if I go and I'm told I have this, okay? So can we just understand, first of all, breast cancer in its essence, and probably talk about, say, where we are at as a country, depending on how you've seen, the patients and the trends.
Yes. So it's a very important question that you bring up. Breast cancer is one of the most common cancers that we see in Kenya. Even in my day-to-day practice, women with breast cancer form the largest number of cancer patients that I see. Unfortunately, almost 70 to 80% of these women come in a locally advanced stage. By that I mean when the cancer has spread beyond the breast to to the glands in the armpit. So we call it stage 3 in clinical terms. So the reason why this is happening is because of inadequate screening facilities, screening uptake in the country. So a few years ago there was a study done by the government of Kenya. They found out the screening uptake for breast cancer was only 13%. It's so less. So when you see diagnosis of breast cancer across the globe, in the Western countries where there is a robust screening program and most women prefer to do the screening, most of these cancers are detected on screening. So these cancers are very small, easily manageable with less complicated treatment, high chances of cure. On the contrary, what happens in Kenya, many women don't undergo screening for various reasons. So by the time they see the oncologist, the cancer has spread. It is either stage 3 or stage 4. So when we are dealing with these stages, the treatment is more complicated, time-taking, side effects, and the chance of having a cure is less. So there are various multiple factors behind why this is happening. So at least with this show, I think the message can go out to women and men in the society that breast cancer is a very serious health issue, one of the most common cancers in women, one of the most common killers for women in country, and it is a cancer where screening is helpful. So screening saves lives. There is no doubt about that. So like cervical cancer, prostate cancer, breast cancer is one cancer that we can screen. Screening can be done easily. So my advice is women, please get screened. That's very important.
Yeah, and we look at the different screening methods that are available. How often should women go for screening? But before that, just to speak a little bit on the men. What are the numbers saying? Do we have even enough data when it comes to breast cancer among men? Because most of the time we focus on breast cancer among women.
So the data says that we have almost 7,000 to 8,000 women with breast cancer, every year. But these are the published data as per, the tumor registries. There will be far more women who have not been, documented. So when we talk about screening, the government of Kenya says that we need to screen women earlier compared to the Western. So in the Western data says that you start screening 50 years and above. But here, because cancer happens earlier in African women, we need to do it at least 10 to 15 years. So what they have recommended is to start screening at the age of 40 years with a clinical breast examination, which is done by a clinician, and a mammogram every 2 years. That is from 40 to 55 years. So yearly or every 2 yearly mammogram can be done. And from 55 to 75, you can do a clinical breast examination and a mammogram every 2 yearly. And what they recommended is from the age of 25 onwards, you do a clinical breast examination. That's very useful, Even a self breast examination also is useful, though it is not a screening method. The reason for doing a self breast examination is the woman needs to be aware of how a normal breast feels and to detect any abnormality at the earliest.
That are there.
So you need to start screening as early as possible.
As early as possible. Yeah.
Very important.
I'm also a bit curious about the men, but we'll come back to you and then understand where are we, on that as far as breast cancer. Is it as common as we think, or is it as uncommon as we think? Okay, we'll come back to you to help with that. But Rachel, can we start with you? So you said 2021?
2021
is when you felt something, okay? Ndiyo. Or is it when ulipata diagnosis?
Ndio ilijulikana.
Ndio ilijulikana.
Yeah.
Okay. So turudi nyuma kidogo, okay? Before 2020, ile time ilijulikana ya kwamba uko na breast cancer.
Ndio.
What was happening? Maisha ilikuwaje? How were you doing?
Mimi nilikuwa tu niko poa na hakuna saini yote yenye nilikuwa nasikia. Nilikuwa tu niko sawa hadi tarehe 19 mwezi wa 10 2020. Hapo ndio nilikuwa natoka Kenyatta Hospital. Kupeleka msichana wangu. Hapo ndio tulipatana na accident pale panaitwa Muthaiga. So ile gari iligonga gari ingine. Sisi tuligonga tukiwa, gari ilitugonga nyuma na sisi tukagonga ile ilikuwa mbele, zikashikana. Na ni hiyo tu gari tunge tuko na kanini na nyuma hivi. Yani ni kama yani sasa nitasemaje, kama zile za kitambo wale wa miaka hiyo wanaona. Sasa kuna nyingine na kuanga hivyo. So wakati ilishikana ilibidi mpaka askari wakuje. Na juu nilikuwa nimepewa rift na ilikuwa wakati wa corona. So hatungetaka kufuatilia maneno mingi, nimeumia nini. But wakati niligongwa, hiyo mlango ilikuja ilitokana ikanigonga kwa titi, ikarudi ikakuja ikanigonga. So niligongwa hivi. Nilisikia uchungu nikajikojorea. Nilisikia uchungu wa 30 minutes hadi nikajikojorea. Na from that minute kuisha nilisikia yani sikuumwa tena. Kitu yenye ilileta shida ni kichwa tu. Sasa kesho yake ilikuwa 20th. Juu ilikuwa tarehe 19. Sasa kesho yake ilikuwa 20, hakuna hospitali zimefunguliwa, kulikuwa na holiday fulani hapo inakuanga mwezi wa 10. Nilienda kesho hiyo nyingine nikaenda hospitali penye nilikuwa nikipeleka msichana wangu ndio akakuwa admitted. So hiyo hospitali nilienda nikawaelezea vile nilipata ajali, wakaniandikia kupigwa picha. Lakini nikasahau kwamba titi ilikuwa imegongwa juu, haikuleta shida tena. So kuanzia hapo daktari aliniandikia niende nifanywe hiyo nifanywe picha ya kichwa, sijui ilikuwa inaitwaje,
MRI,
ilikuwa CT scan. Nikafanywa hiyo CT scan na nikapeleka, nikaambiwa niko sawa. Sasa nilianza kusahau, nilikuwa ninasahau, na after 3 months juu nilikuwa naenda naona daktari, nikasikia ndani ya hiyo titi yenye iligongwa ndani kabisa ikaanza kumea kama titi kengine ndani, kama vile msichana anaanza kutoa matiti. So kwa titi langu ndani ilianza kutoa katiti kengine. Sasa ikakuja ikikuanga tu kubwa tu, ikakuja ikafunika hiyo ikakuwa kimawe. Sasa nilikuwa naandika kwa mkono. Kifungu yangu nilikuwa nimezoea kuweka hapa hivi. So nilikuwa naandika kwa mkono. Matiti yangu yani venye nitakuja kuambia daktari. Lakini nikifika pale sikumbuki. Nikifika kwa nyumba naanza kunawa mikono, ndio naona sikuambia. Kaambia mtoto wangu, hebu usiende shule, unikumbushe niambie daktari shida hii matiti. So alikaa akinipigia simu mpaka nikawa nimeingia kwa daktari. Hiyo hospitali iko Mathare. So huyo alikuwa daktari amekoma kabisa, Mjerman. Wakati aliniona akasema niende room number 9. Wakati nilienda kanifanya ultrasound. Sasa kaanza kuambia mwenzake pale, juu nilianza kuambia tonsils, unajua mimi sijui Kisungu. So nilianza kuambia huyo daktari mkarimani mwenye alikuwa pale sister, nikimwambia niko na tonsils hapa, alikuwa ananiambia hakuna tonsils zinakuanga hapa. So nikaona ananizuilia, mimi nikaanza kuambia huyo daktari hii tonsils mpaka akataka kushika ajue ni nini. So wakati alishika akaniambia niende anipige hiyo ultrasound, ndiye akapata kuna hiyo uvimbe. Juu ilikuwa imevimba kwa matiti pia hapa. Sasa kwa hivyo daktari wakati alimaliza hivyo, nilisikia akisema tu it's look like cancer but I cannot say it's cancer. Mimi nikaanza kukemea kimoyomoyo, shindwe. Unaona? Sasa nikaanza kufikiria ni gari tena, nikaanza ndio akasema tumpatie barua aende Mama Rusi. Nikawaambia niandikieni ya kwenda Kenyatta. Wakaniambia hapana, si tunaandikia watu wakaenda Mama Rusi juu Kenyatta wengi wanakataanga kwenda. Mimi nikakubali tu nikaandikiwa. So kukuja sikukuwa hiyo mambo ya NHIF. Nikaweka hizo makaratasi zangu huko, na by then nilikuwa nauza switi na nilikuwa napimisha ile kilo ya kukanyaga chini. So unaona hapo hakuna pesa. Nilienda tu hivyo, titi kikuwa kubwa mpaka sasa ikakuja ikashikana. Sasa katiti kandani kakafanya kititi kikakuwa kimoja kubwa na kilikuwa kia rangi ya orange. Lakini kukua inauma hata kidogo. Sasa nilikuwa tu nimekaa tu. After hapo ndio sasa nikafanya mambo ya NHIF, nikalipa na nikaanza nikajipatia transfer kwenda hospitali ya mtoto wangu alikuwa amelazwa huko Kinangop. Wakati nilienda daktari wa huko pia akaniambia venye daktari wa Kenyatta alikuwa ameniambia nifanye mammogram. So date yenye nilipewa huko ikashikana. Daktari wa huko ameniitisha mammogram, wapande yeye ameniitisha mammogram. But nimeenda huko sababu niharakishe. So wakati niliuliza mammogram nitafanywa wapi? Nikakuta bei iko juu sana. So hadi mmoja akaniambia enda Kenyatta. Hospitali kuu ya Kenyatta ndio wanafanya na bei ya chini. Wakati nilienda nikakuta ni kweli. Hawa wasichana wakaniambia niende nilipe 2500 niwaletee receipt. Hakukuwa na watu. hata nilishtuka sana. Nikaenda nikalipa kuwaletea, wakaniambia nitoe blouse. Kutoa wakaniambia ai, si hata afadhali tungekuwa tumekuangalia, sasa hii itafanyikaje? Juu ni kitu kimekuwa kinono kabisa na kimetani kala. Nikamwambia wewe sifanye hivi, nisaidie tu, mimi nitavumilia. Nilifanyia hiyo mammogram na nikasikia wakiambiana ni yangu iharakishwe. Nasikia Kizungu lakini kuongea sana ndio shida. So waliniambia tu wakaniambia usiende juu umeleta hii barua. Nilipatiana barua ya kutoka huko Kinangop. Wakasema usiende Kinangop, fungua hapa kwetu uanze kutibiwa. Nikamwambia already niko hapa. Ni vile niliona kuna delay. Akasema sasa kwa maana hapa. So hiyo wakati nilipatiana hiyo barua, hiyo picha, ndio sasa nikaandikiwa wengine tena kwenda kufanya nini? Kutolewa biopsy.
Wacha to pause up. I don't know how much of that you got. Quite a substantial. And we'll come back to you to then understand, because there's usually that expectation that, yes, you will see a lump first, and then you will go to the hospital, and then they will tell you, let's try and see what this is. Could be, non-cancerous, could be cancerous, like the usual procedure. But then again, that is not the case for so many women. That is not how they find out they have breast cancer. So we'll come back to you to then understand, first of all, the signs, the different types of breast cancer, and even the different types of presentations. But Nana, can we speak to you? 2020?
2022.
2022.
Yes.
Okay, let's go back to 2022.
So I didn't feel the lump in 2022 actually. So mine, I felt a lump in 2020 during that time when COVID was everywhere and people. So I got anemic and I had COVID.
Oh, wow.
But I remember the doctor could ask, why are you anemic?
Yeah.
But then I had felt a small lump.
Way back in 2020.
That is 2020. So I got sick in July. And I had that. But at the back of my mind, I was thinking, hey, man, this can't be.
This can't be.
I was scared to death. And then I had just come from a nasty separation. And then I'm thinking, how do I jump from here to fire? From hot fire to hottest fire. So what I did for 2 years, I was quiet. I literally took painkillers for 2 years. Because every day, my breast got very painful. And I had really big breast. These ones were all chopped by these guys, these the Bendix, Lilith and these friends, they chopped them off. Because, they reduced this, the left one, they reduced, then, first they removed this mastectomy, then they reduced this. Later I came for reconstruction, so they reconstructed these afresh, and then reduced this. So I have a story.
Wow.
So when I went after that, my breast, I was sick. Since 2020, 2021, then 2022, it was very, very bad for me. I was extremely sick. From January, every day, like a tap which is being closed, like my body was shutting. But me, my breast was never swelling. It was just extremely painful. So when I removed my bra, I just hold it like this, put a kitambaa of cold water, take painkillers and sleep. In 2022, I stopped sleeping with this side because now also the hand, the shoulder, everything is now not working. So August, my breast dimpled, like a dimple. We call it tethering. I was so scared, and I told my sister, hey, look at what happened to my breast. And she said, we have to go to hospital. That is how my journey started.
So at this point, you've not even told your sister what's happening. You just tell her.
I just told her, this breast has been giving me problem, very casually. Like, Ruth, this breast has been giving me problem, but look at how it looks now. This is very strange. Then, when I touched that lump, it was very painful. Then it could jump from here to here. I could feel it here. So when I went to hospital on 1st of August 2022, my case, the doctor we saw was like, this is urgent. This needs attention now. So I was sent for mammogram, for ultrasound, I did those immediately. Of course, the mammogram, the results showed that I didn't even have one lump. I had 3 lumps. I had axillary nodes. Then biopsy. You know, now the thing which determines if it is really cancer is only biopsy. Dr. Lalito say that. So I did my biopsy. Biopsy showed, of course, the results were positive. I had axillary node, and let me tell you, that was the diagnosis was so bad to me. I sometimes I look back, I thought all that, and I'm like, wow, it was very bad for me. I never thought I would pull through, but thank God, I have a very strong support system, amazing siblings. Immediately they formed with fundraised with my friends. In 6 days, that fundraising was closed because in 6 days we had 3 million.
Oh, wow.
So it was closed.
Yeah.
So even by the time I'm starting the treatment, we had money, we had a good support system, good environment. And that is why I say every day I tell families, please, even if Dr. Lalith is treating us, you need to support your people. Yes. Because support system is extremely important. I think for me, God played this role and the support system played a big role, because in 1 year time, I had done all the treatment, and the end of August 2023, I was declared cancer-free. In 1 year, I did my reconstruction. In 1 year, I'm out and about helping others. In 5 years, maybe we will have a hospital which is free for these people. You know,
that would be really fantastic. That would be really fantastic. But you're here, both of you really, and we celebrate you for sharing your stories with us. Doc, I don't know how much of Rachel's story you paint, but it's more of an accident, and then she was hit on one side and you know, one part of her breast as well. And before that, you know, when she did the CT scan, she was cleared, she's okay, you know, the head, but then after a while, the breast started bringing problems. Sort of like a breast growing inside her breast. Essentially, that is what she was saying, and then grew bigger, it grew bigger. And what I'm hearing from this too is so she felt a lump, she didn't feel a lump until that accident happened. So, and I know we only have like 2 minutes to go. So is that enough to just talk about then, say like the different types of cancers and the presentations? But we can actually just pick up after the break from where you would have left.
So briefly we can discuss regarding the clinical presentation. Most of the time women will present with a lump in the breast, and it is most of the time not painful. That is the reason women tend to neglect their lump in the breast. If compared to somebody having a painful lump, they will go to the doctor immediately and get it checked out. But breast cancer lumps are usually, you know, painless or associated with mild pain, you know, dull aching type of pain. And also they can have, you know, similar enlargement in the armpit also, or above the collarbone because of lymph node enlargement. They can have nipple retraction or changes of the skin, something akin to orange peel appearance. So this means that the cancer has involved the skin of the breast. So these are all signs of, you know, locally advanced cancer, stage 3 cancer most commonly. Sometimes breast cancer can spread to other parts of the body. So it can spread to the brain. So patients can have severe headache, vomiting, convulsion, visual problem, they can't see properly. The other areas where it can spread is it can spread to the lungs, causing chest pain, breathing difficulty, cough, you know, blood while coughing. It can spread to the liver, causing jaundice, weight loss, distension of abdomen. And the last side where it can spread very commonly is to the bones. Any bone can be involved. So patients can have severe pain. They can develop a fracture following a trivial injury. It's called a pathological fracture. So these are the ways in which, you know, women with breast cancer can present.
Yeah. And Rachel talked about the color turning orange. Which, again, we'll come back to you to understand why that is the case. But we're due for a break right now. Remember, there's so much to come on the other side of the break. The conversation today is on breast cancer, being Breast Cancer Awareness Month, the first day of October. And the question that we're asking you this morning is, if you could send one message to every man or woman out there about breast cancer, what would it be? We'll be looking at your feedback as well after the break. Do stay with us. The show is Your World. Welcome back. Welcome back to the show. It's Wellness Wednesday on the first day of October, and it is Breast Cancer Awareness Month. And we're kickstarting off the month with a conversation on Feel It to Fight It, the power of early detection. And we're looking at Breast Cancer Awareness Month, which we said the theme for this year is every story is unique and every journey matters. And we're looking at two different stories here on the show today. And the question that we're asking you this morning is, if you could send one message to every man or woman out there about breast health, what would it be? If you could send just one message to every man or woman out there as far as breast health is concerned, what would it be? We'll be looking at your feedback as we continue with the conversation right here on Your World. But this is Pam Cornelius, who says, one day we will defeat cancer. It will be a past tense. Keep pressing on. Do not give up, sisters. So thank you so much for that. We'll continue with your feedback as we continue with the conversation. But Doc, yes, you were talking about the different sort of like presentations as far as breast cancer is concerned. During the break, there was this conversation about, which Rachel brought up, that she was told we all have breast cancer. No, we all have cancer cells. Some are dormant and they could be triggered by anything. Say, for example, in her case, the accident sort of like triggered the cells to like lump together and form breast cancer. So can we just start with answering that? Is that true, that we all have cancer cells?
So the accident triggering the breast cancer is not true. So what happens, many a time a woman with breast cancer would notice a lump following some accident or some injury to the chest, That is the time it becomes apparent, though the lump would have been there in the body for a few weeks to months, but the accident brings attention to that lump. So it is not that accident can, lead to breast cancer. It doesn't happen. But having said that, one must know the risk factors for developing breast cancer, why it happens in women. And I need to add that even men can develop breast cancer. So it's very important that, the people listening to this show be aware that even men can develop breast cancer. And I have a few patients with male breast cancer who have treated them before. So when it comes to breast cancer is a hormone sensitive disease. So it has something to do with, early menarche, some lady having a menarche before 11 years. It is considered a risk factor. A late menopause, late first childbirth beyond 30 years, breastfeeding done for short duration, So recommendation is a woman feeds more than 12 months, it is a protective factor for breast cancer. Apart from that, there are other factors like, somebody having a family history or carrying deleterious genes, family history of breast, pancreatic, ovarian, prostate cancer, it can be a genetic. So 5 to 10% of breast cancer can be a genetic, passed from one generation to another. Apart from that, other risk factors are, lack of physical activity, obesity. These are the newer risk factors, very common in Kenya now. Obesity can lead to, development of breast cancer and other cancer, using highly processed food. So somebody who has received chest wall radiation for various reasons when they're young, they can be predisposed. Somebody having diagnosed with breast cancer, not neglected. That's very, very important.
I say that, and when you talked about early menarche, starting your period
before 11 years.
Before 11 years.
Before 11
Why
years.
Is that a risk factor? Because we're seeing a lot of young girls.
So it exposes a woman's breast to estrogen for a longer time compared to somebody having, menarche at the regular age. Since breast cancer is a disease responding, the estrogen hormone is responsible. It plays a part in the pathogenesis. So when somebody has an early menarche and a late menopause, the duration of exposure to the breast is longer compared to somebody who doesn't have.
Oh, wow.
So these are, few risk factors.
Okay. Then does that mean we need to screen? Remember you talked about the 40-year-olds. Does that mean that then we'll have to screen even like 30-year-olds, 20-year-olds, even 10-year-olds? Say, for example, this is my brain just doing all these questions, but hey, we'll come back to understand that. So you did the test, mammogram, all these tests, and then the diagnosis came. So at what stage were you diagnosed, and just how was that moment for you just receiving this news? Because again, like you said, since 2020, you noticed the lump, but you were like, no, this cannot be it. I do not want to believe it. It is what it could be. But then again, so 2022 is when the diagnosis came. So let's talk about just that period of receiving the news that, hey, this is breast cancer.
Let me tell you, Winnie, cancer diagnosis is never easy to anyone, no matter who you are. You know, this is not just a disease. It's more of a disorder, and maybe probably a permanent disorder, and a disorder which is at 60%, it can kill you, right, Dr. Ladd? So it was very, very heavy for me. I'm not lying to you. At first, I even told God, me and you, separate, because you can't let me pass through, or you want to mean every cup. Nana has to take every cup. No. So it was heavy for me. I have children who are bringing up alone. I have all these responsibilities, and then these. And you know, at the back of my mind, I knew, I had heard that, at the back of my mind, I knew, I had heard that cancer kills. I never knew that, by the way, I will survive. And then it is very costly. And you can imagine now, Rachel will understand. Rachel anaelewa nikimaanisha, ukiambiwa uko na hii ugonjwa na uko na watoto peke yako, it hits differently, by the way. It was so heavy on me. By the way, it took the hand of God to get me from that deep hole. It was so deep for me. I sank deep inside. But again, you know, God has a way of doing his thing. People turned around. Situations were turned around, and a whole army was formed to support me. So when this came about, because my sister kept on telling me, you can imagine, because as we started with topmost private hospitals in this, I don't want to mention names. So my biopsy alone was 130,000. 130, and I had 8 other tests to do, Winnie. And this is someone who is hawking shoes. I used to hawk shoes from Eastleigh, pick some in Eastleigh, walk from Eastleigh to Kamkunji, because I cannot afford that shillings to go to Kamkunji. Pick those shoes, come hawk them in community, Westlands. And I'm like, how do I even start? And for your information, Winnie, why I even never went for checkup is due to lack of money. Because every time, you know, to say I'm breast specialist, breast on-call, it is 4,000 or 5,000 consultation alone, with no single coin for Panadol. So every time I would have that money together, my husband would be like, hakuna gas, hakuna chumvi, hakuna tissue. I'm like, you know what I mean?
Yes.
It was so difficult. So it was even that I didn't go to hospital because sometimes I think I'm like, Nana, but that was a lie.
Yeah.
It didn't go because it did, and that is why I understand all these women. I understand all these breast cancer patients. When they say, I have nowhere to sleep in Nairobi and I need to do the therapy, I'm like, I have a rescue center. And people are like, which rescue center? My house. People are like, but you are traumatizing your children. I said, those are my children. You stay with yours. We deal now.
Yeah. And they've seen you going through sort of like the journey.
And you know, Winnie, for me, after diagnosis, my sister picked me up with my children, with my rats, paka, panya zote. We went to my sister's home for 2 years.
Oh, wow.
2 years I
Bless
was.
her. Is she watching today?
Yeah, Faith.
Hi,
I went to
for
her
the
home for
support.
2 years.
Yeah.
So you can imagine, for me to house people is nothing because I was also housed. But it is also a heavy diagnosis.
Yeah.
I thank God. I was surrounded by amazing people who helped me to accept very quickly, because the biggest problem we have is people to accept that you are sick, you have a problem, and it is a big problem. You need help from God, from people. We have people hiding sickness, thinking that it is why me? It is never about why me, my friend. It is how do I get help? And for me, Winnie, Rachel will tell you, Dr. Lalito
She actually reacted when you said acceptance.
Yes. You know me, like, it's not only now I removed my compressor, I put it on a lot. And everywhere people say, Nana, what happened to your ad? Even my kangas everywhere. And I'm like, it's breast cancer which messed me up. People are like, oh, I'm like, no, but I'm healed. Let me tell you, and that has helped me. I speak about it. I tell, whether you want to listen or not. Actually, Dr. Lalita and Rachel will tell me, because these are my good friends, they'll be like, my first introduction is, my name is Nana Kilemi, I'm a breast cancer survivor. That is the first, because we need to get people out of the thing of that cancer is, and it is not a death sentence. Look at us. Lalita will tell you, Nana, me with 99 of my friends, I am more healthy than most of them, true or false.
Because you've learned to take care of yourself. And thanks, Nana, for that. And Rachel, there's something that you said, ya kwamba najaribu kuambia huyo interpreter ule alikuwa anaambia daktari what you are saying, wanakuangalia zile za this is not it. Wewe ukajiadvocate, which is really good, advocating for self na kusema hapana, this is how I am feeling, hivi ndio nasikia, tonsils here, daktari ajue ni nini hiyo. And that is really, really good. Hiyo ni poa kabisa. So when she was talking about, hey, acceptance, I saw you doing like this.
Nipe tu nafasi niongee hiyo.
Please do.
Na nataka kwanza ni shukuru daktari wetu Uladiki kwa kutoka Roy Family. Wametuongezea mashini ya radiotherapy. Tuko na shida sana.
That's really good.
Yes. Na shukuru pia Madam Nana, amekuwa akitusaidia na food. Hiyo kitu sikutaka yani nitoke kama sija appreciate. Mtu apewe maua yake akiwa hai.
That's true.
Haya, sasa nikuje hapa, nataka uniulizie daktari but sio sahizi. Hii kitu ya kuacceptiwa ati mtu akubali wewe ni mgonjwa. Niko na hiyo vita sana. Rachel, wewe si mgonjwa. Ulimaliza matibabu 2020 na mimi nilijulikana 2021. Mwezi wa 4 ndio nilikuwa confirmed niko na cancer. So ninasemekana mimi nadanganya watu niko mgonjwa, nilipona kitambo. Kwa sababu gani? Ati niko na mashavu na nimenona sana. So mimi nafanya kutumia ukora kusema mimi ni mgonjwa. Sasa nilikuwa nataka daktari atuambie, inasemekana mtu mwenye anaenda through chemotherapy anafaa konde kabisa. Nywele inang'oekanga ama inakosa kung'oeka, lakini inafaa mtu akue amekonda kabisa. Sasa community kutu accept sisi ni wagonjwa inakuwa ngumu sana. Wengi wanasema ni uongo. Hata tuseme kama sasa Madam Nana asiposema alikuwa na kanza, kuna mtu ataitikia? Hakuna mtu atakubali. So hiyo kitu imekuwa ikitupatia stigma sana, na kukubarika tuko na ugonjwa inakuwa ngumu. Mimi sasa nimetoka the Nairobi Hospital, nimefanywa already radiotherapy na niko na receipt hapa. Nitawaonyesha nimetoka hospitali. But uko nje kwa ground mambo ni tofauti. Rachel alipona kitambo, ni kudanganya anadanganya. Anarudi anasema tena Rachel ni mnono. Mtu wa kanza hafai kuwa mnono akiwa kwa matibabu. Haya, nilikuwa naomba daktari wetu atuambie aje ni kitu gani kama mtu wa kanza. Mimi vile najielewa ama vile naelewa, ni ukweli nilikonda 2021 nikiwekwa chemotherapy na nikakuwa mweusi kabisa kama itroza. Hata ulimi ilikuwa hivyo. But hiki mwenye nimewekwa this year, juu nimerudia chemo zingine this year, nimemaliza mwezi wa 5 date 27. Na sasa nimwambia niko radiotherapy, sijakuwa mweusi na si kukonda, lakini ulimi yangu ilikuja ikatani nikakuwa black. So nilikuwa nataka daktari atuambie ni ukweli hivyo, yani ni lazima mtu akiweka hiyo dawa akonde, ama ni lazima mtu mwenye akona kanza akuwa amekonda. Alafu lingine acha jibu hiyo. Okay, lingine before nisahau, tulikuwa tunafunzwa aje, that was 2021. Katika interview ya mtu wenye anafanywa kama uko na kanza unaulizwa maswali mingi. Pia kuna vile daktari alikuwa amesema kwamba mbali na yenye nimesema saizi, alisema kwamba pia kuachanisha watoto zaidi. Atumezaa mtoto, mimi nasema yenye niliambiwa, that was 2021. Na tuliambiwa tukiwa wengi. Ingawa daktari wetu amesema sio ukweli hivyo, ni vizuri kujua kwa madaktari tofauti. Ati mtu akiwachanisha watoto, tuseme my first born ni wa 1995. Second born ni wa 2003. Wamewachana na mbali. So nikasikia watoto wakiwachana hivyo, ati kuna uwezekano mama apate kanza, lakini ya hormones. Niulizie kama ni ukweli.
Okay, yeah. So the age gap between children, is that a risk factor for breast cancer or cancer in general? And then the other question was more on stigma, from the people, because they say when they look at her, the diagnosis came in 2021. Ndio uliambiwa uko na cancer, and at that time she lost so much weight. Her skin color changed, and a lot of people would believe then that she had cancer. Yes, and she lost so much weight, right? But now she's still on treatment, but she's okay, right? But people are like, no, you're lying. You do not have breast cancer because, you're okay with, say, your weight, because the expectation is you lose so much weight, right? So those two problem myths
So there's a lot of stigma, misinformation regards to cancer, not only breast cancer, for all cancer. One way, like she discussed, it's not a death sentence, not at all. I mean, we are in 2025, it's, era of modern treatment.
A lot of advancement, yeah.
Available in Kenya. So many things are available, be it for breast cancer, for any cancer. So definitely it's not a death sentence. Even if it is a stage 4 cancer, we can do meaningful treatment. We can improve the quality of life, make few patients live longer. So it is definitely not a death sentence. And there's a lot of stigma, myths, regarding breast cancer. Like she was saying, she doesn't want to put the, the compressor because people will ask her. I mean, that's again a misconception. People also feel that it is contagious, from one person to another it can, be transmitted. And they should not take treatment on time, or treatment is having a lot of side effects, it is very painful, it is disfiguring. So there's so many, stigmas deeply rooted in society, which prevents patients from taking treatment on time, which is very, very unfortunate. Yeah. So many of my patients in my practice, day-to-day practice, by the time the cancer is diagnosed and they come and see me, it will be months to years sometimes. And if you don't treat cancer on time, it is going to spread or increase. Yeah. So from cure, it becomes palliation. We lose the chance. The best chance is at the initial time. Okay. If you delay any treatment, then the chances of cure becomes very, very difficult.
Becomes a bit complicated. Yes. And can you just talk a little bit about then the progression from, say, one stage to the other? What are some of those factors that could either accelerate the progression or just help to sort of like delay the progression?
So it is not exactly a progression that happens. So what happens whenever a woman is diagnosed with breast cancer, we are going to, do tests to know the stage of the cancer. So commonly there are 4 stages, 1, 2, 3, and 4. Yeah. And 1 and 2 are early stage cancer where, you do surgery, chemotherapy, and sometimes radiotherapy. Stage 3 is a stage where multimodality treatment is required. You do chemotherapy, surgery, and radiotherapy. And in stage 4, most of the time, we do only, palliative treatment. Most of the time, it is chemotherapy. The issue comes when a patient having been treated for cancer has a relapse or an incomplete response. That is when things become a bit difficult. If the relapse happens following, a treatment. So a patient completed treatment just 6 months ago and they got the cancer back. So these women are not going to do well, they're not going to respond well, their outcome is not going to be good. So this can happen, So progression, relapse of disease can happen. It is quite common. Okay. So that is related to various factors. What was the stage of diagnosis, what treatment was done, was treatment done on time. A lot of biological factors which are beyond the patient's control. It is the biology of the cancer sometimes that dictates. Sometimes cancer is very aggressive. So despite doing all treatment, it is going to come back, or it might keep recurring. It will respond, come back, respond, come back. Yeah. So all that, that spectrum we see in day-to-day practice.
Okay. Yeah. And just to answer her question on the losing weight and associated with the treatment, because she was told, if you're still on treatment, then you must lose weight. But then you look at her now, you wouldn't even tell that she's actually
It is not a must that patients should lose weight. Patients, cancer patients lose weight because of, the advanced stage of the disease. It can cause weight loss, low appetite. And sometimes treatment can cause, lack of appetite because, sometimes patients can develop sores in the mouth. So temporarily there can be a weight loss. But it is not always that patients should have serious side effects, debilitating side effects. And, on the contrary, most patients can continue doing their work, day-to-day activity. Just on the day of the treatment, they come to the hospital. Next day, they are back to their regular life. That's the way it should be,
Yeah. All right. Rachel, daktari anasema si ukweli that ukikuwa still on treatment ati lazima uta lose weight. Hapana, si ukweli. It's not true. It's different from patient to patient.
Sawa.
Sure, yes.
Haya, swali langu yenye hajasema ndio ama hapana. Hapa pa watoto kutenganishwa. Mimi mtoto wangu wa kwanza ni wa 1995, wa pili ni wa 2003 na nimepatikana na hiyo breast cancer na nasemekana ni mambo ya hormones. Sasa tuambie tu asinini story mrefu ni ndio ama hapana, hivyo tu.
Doc, the age gap, okay? Is it a risk factor for within?
It could be a risk factor.
Yes,
in
or
our
no?
case, it's quite possible that it could be a risk factor.
Okay,
yeah.
why is that?
Because of, the extended period the breast has been exposed to, estrogen. Like we discussed, it's a, hormone sensitive disease. So delaying birth can be a risk factor.
Okay,
yeah.
all right. Inaweza kuwa, yes. It's possible. Uko na swali lingine? Wacha tusikie Nana and then we'll come back to you. Okay.
So I wanted to talk about the stigma because she's more on stigma. All those things she's talking about is stigma.
Yeah.
So you can imagine if they stigmatize me. I'm vocal. I can tell anyone anything. I fear nobody. They stigmatize me. What about Rachel and others? So let me tell you why most of cancer patients don't want to talk about it is a stigma. I'm telling you, stigma is real. And I'm talking, Rachel, as early as last week, Thursday, where someone who was so close to me hurt me so much because of a conversation they had with a friend, a mutual friend of ours, who happened to send me that conversation. And this person said, we have to be soft with Nana because she has been sick. We can't be wrong. We have to handle her with care. But after all, she's still nothing. And this is someone who is learning, exposed, they say that. I have that conversation. That is someone who was so dear to me. So you can imagine, a stigma is real. People need to stop the stigma. You know why, Winnie? This cancer thing, you don't know where you will wake up tomorrow. Nobody knows.
Yeah.
So people need to stop stigma. Number 2, people need to take their people to hospital. Pelekeni watu hospitali. Dr. Lalit has said, we're in the 21st century, it is all advanced. In the villages, the hospitals are there. In up country, the hospitals are there. The medication is the same. If you need radiotherapy, go to the hospitals which have radiotherapy. Now, there's a very good collaboration between public hospitals and private hospitals in treating cancer. Take people to hospital. Cancer is not witchcraft. Because Nana is not cursed. Neither is just a cursed because we had cancer. We didn't do nothing wrong. Take people to hospital. Stop locking people at home. Number 3, stop chasing people at home. Because now when what is happening, if God forbid, I didn't have any when I was sick. I don't know, maybe I intend to have one. My husband will chase me away because I'm sick. Or me, I'll chase away my husband because they're sick. That is what is happening. I'm telling you the truth because I run an organization which has over 2,000 people under our care. Most of these families, they are abandoned by spouses, by children, by families. Let me tell you, my friend, as you chase that person away, just know this is like a merry-go-round. Every dog will have its day. Be careful. Stop chasing people away. Number 3, number 4, Winnie, as I close this, please let us pay for SHA.
Okay.
Tafadhali wa Kenya, can we stop politicizing everything? I have not been sent by anyone. I don't support the nonsense going on in this country, but pay for SHA. Because when it rains, I'm telling you, when it pours. SHA is a real deal breaker for oncology patient. Rich, poor, everyone. It is the equalizer, the last one. When your loved one gets sick, before you go to hospital, please do research. Do not take your patient to a high-cost hospital and you are doing fundraising. I was treated in a public hospital here in Kenya by our doctors. Amia, she's also getting, he is here. Why are you rushing patient? You know, cancer is a long-term problem. Right now, I'm still on hormone therapy medication for the next 10 years. That medication costs around 36,000 per month. It is a long-term. Do not rush people to, because you know, when we have a problem of class also in Kenya. I want to be told, I mean, this and that. Cancer doesn't recognize those things, my friend. Those are non-issues. Do due diligence. And me, I'm telling you, Winnie, because most of the Kenyans, actually 60% who are sick, are low middle class, not upper, low middle class, and the poor people. Sorry, it is the truth. Tafadhali, can you take patients to hospitals you can afford?
Okay.
Thank you.
All right. Thanks. I mean, Nana, listen, we're just due on a break, and then when we come back, we'll still talk more on this. And even just look at the cost of treatment, and Dr. also help us understand. So then, what is it that we can do to either reduce the cost of treatment or even the approach when it comes to cancer treatment right here in the country? Yes, we've made progress over time, but what is it that we need to do more? Because there's so many people, like both of you have said, watu wanaogopa kwenda hospitali, not because hawataki kutibiwa, but because we can't afford, you know, the treatment. So all that is coming up after the break. The conversation that we're having today is on breast cancer, because it is Breast Cancer Awareness Month. And the question that we're asking you today is, if you could send one message to every man or woman out there about their breast health, what would it be? All right, welcome back. Welcome back. Glad to stay with us. 3 minutes past the hour, and the conversation today is on breast cancer. And like we said, October is Breast Cancer Awareness Month, and the theme for this year is on every story is unique and every journey matters. And we're looking at how then can we improve breast cancer screening, diagnosis, and treatment right here in the country, because we've seen a lot of cases of misdiagnosis, delayed diagnosis, and the biggest question is then, what do we do to improve that? Yes, we've come a long way, but what is it that we need to do differently or to do better? And the question that we're asking you today is, if you could send one message to every man or woman out there about breast cancer, what would it be? There you have it, the question of the day. If you could send one message to every man or woman out there about breast cancer, what would it be? So Gerald Odhiambo Sido says, Hospital A confirming your breasts are normal should not hinder you from visiting Hospital B and C if you strongly believe something is not right. Missed diagnosis is real. And then another one says, this is Macau, who says, hang on, tomorrow is a better day. Just keep hope alive. We are in this together. And then another one says, Kwamboka Jamila, who says, one day we will finish this monster. We never give up. Okay. And then another one says, this one says, okay, this is Duke Masira, says cancer kills more patients than pneumonia, malaria, and AIDS combined. Early screening is advisable. And then another person says, Wanjiku Masi says, cancer will die too. The biggest question is then, what can we do collectively to help with that? Doc, there was a question for you.
It was regards to breast cancer risk and use of oral contraceptive pills.
Yes.
So many studies have clearly shown that the risk is very minimal, so it is not a very important clinical factor. So the only thing, OCPs are not to be used in a woman who has survived breast cancer. It is not recommended. Otherwise, they are safe to be used in the general population.
Okay,
yeah.
All right. And Rachel, so ulienda hospitali, ukafanya mammogram, ukafanya, you know, all those things, and then all those tests rather, and then ukaambiwa sasa usiende. At that time ulikuwa referred to from which hospital? Kiambu?
Nilianza Kenyatta.
Oh, Kenyatta, okay.
Ndiyo.
So ukaambiwa hapa ndo utabaki, and your case was urgent.
Hapo ndio nilijipeleka.
Hapo ndo ulijipeleka.
Nikajitoa after kuona corona vile kunaenda.
Yes.
Ai nikasema hii matiti itatoboka. Unajua tulikuwa tunaenda na jamaa mwingine sijui kwenye alienda. Tulikuwa tunaenda tukiuliza kila hospitali mnakatanga matiti. Kozi tuliambiwa na mama mwingine alikuwa ameshatolewa na akasema hii matiti vile inafura hivi itatoboka. So kuna kijana alikuwa ameleta mama yake pale.
Okay.
Naye yake ilikuwa imetoboka na ilikuwa inatoa harufu sana. Sasa huyo kijana akasema si tutafute tu vile tutaenda hospitali. Huyo mama akatuelekeza hospitali kadhaa huko Kitengera. So tulienda tu, tulichukua hiyo gari tukaenda, alikomboa gari nikamuongezea 200. Sasa tuko tunaenda, sasa mamake anabaki kwa gari kwa sababu hangeweza kutembea. Ilikuwa mimi na yeye. Tunaenda reception na wauliza habari yenu mzuri, mnakata matiti.
Yeah.
Unaona?
So kidogo tu hivi.
So kuelezewa unaona hii story about cancer, mtu akiona akiambiwa ako na cancer, kitu cha kwanza anafikirianga kifo. Hata mimi ni hivyo nilifikiria. Hakuna mtu anambianga ako na cancer anaona kupona. Lakini ningetaka daktari wetu anaitwa na
Dr.
Lalik kutoka Roy Family ajaribu aelimisha watu pale nje. Kuna hii kitu inaendelea sana na yeye ni daktari, at least ataelezea watu wataelewa. Pale ambapo tunakaa kwa maplot kwa sababu wengi tumerent. Unakuta kuna ile stigma ya mimi sitaenda choo yenyewe mama anaenda atatuambukisha. Unakuta mimi kama kamba zangu hata zikuwa zinanikwa nguo. Kwanza wakati nilianza kung'oeka nywele the year 2021 ilibaki tu hivi kidogo nijiue. Kidogo tu kwa sababu niliona kansa imeniingia, dunia imenikataa. Hakuna mtu mwenye ako kando yangu. Huku anaendelea kusema nitawaambukisha kansa. Tulikuwa na choo 2 na bafu 2. Ile choo nilikuwa naenda niliwachiwa. Bafu yenye nilikuwa naenda ikawachwa kuwa yangu. Mtu mwenye anakuja mgeni kwa plot kuulizia nyumba anaambiwa unaona zile kamba za black zile ni za yule mama namba 11 na ni mgonjwa wa kansa na mkicheza mtaambukishwa. Kuna watu walihama plot juu yangu. Nikichukua tuseme nikiweka kemo nilikuwa naeko after 21 days that hiyo 2021. Nikikuja sasa nikikaa 1 week, hii wiki ya pili nilikuwa najaribu kufanya mazoezi, mkono yangu isiku. Unaona hii mkono vile inakaa? Tutafika pale. Unaona hata sina matiti mimi nimetolewa zote. Tutafika pale. But nataka daktari asaidie watu hapo nje. Sasa nikifungua fereji hivi ati nachota maji ya manafua, watu penye tunatengewa na mwenye plot kufuria nguo, walihama wote, kila mtu akaanza kufuria kwa mlango yake. Unafungua fereji, ukimaliza inaoshwa na hii brush ya kuosha viatu ukiona. So daktari tafadhali aelezee tu watu kama ni ukweli sisi tuna uwezekano wa kuambukisha wengine kansa kwa kutumia tuseme choo,
the same facility
kuanika kwa kamba ya mtu, at least wapate kuelewa.
Yeah. And I think Doc had mentioned this. She's talking about the stigma and the misconception out there that cancer is contagious. And she's just expressing how she was treated where she was living at that point, where people did not want to share the same toilet, the same bathroom, even the taps where they would, you know, do laundry. People did not want to share because, you know, she's contagious, quote unquote, and her message is please educate the people out there.
It's extremely unfortunate that she had to face this, and cancer is not contagious. That's the only sentence I will say, nothing beyond that, you know, it is not contagious. So please give love and respect to your family members having cancer. That's very important. At home, in the community, at your workplace. You know, she talked about support. That's very, very important, you know. So studies have shown very clearly, you know, cancer patients receiving treatment along with some support member, you know, a family member or a relative or a neighbor, they do better compared to somebody who's coming on their own, you know, because that way they have support, you know. It's not easy navigating the treatment, you know, right from getting a blood drawn or getting the chemotherapy, surgery, radiotherapy, navigating through a busy hospital, you can get lost, you know, and it's very tiring, you know. So having some support is very, very important. So I will request people listening to this, you know, show, please give support and love to patients, you know, patients with cancer. That's very important.
Yeah, and you see, this is, you're vulnerable at this point and you need all the help and all the support that you can get, and then to experience, you know, the kind of stigma that Rachel Alipitia, it's not even fair, you know, for humanity, it really isn't. So love and support is the best that we can do. And even for you, Nana, you said, yes, you had a very strong support system. You know, a group was formed, Tukachanga, and within no time you had enough funds to support you with the treatment journey. But even with that in mind, you as a person at this point, how are you doing mentally? How are you doing physically? How are you handling all this, you know, possibilities where you said you had mastectomy on your, was it left or right?
Right.
On the right, right? So just going through this journey, right? And just going through with the theme that every story matters and every journey, matters as well. Just help us really understand that, and then we'll come back to Rachel, atuambie the treatment journey for her.
So I think for me, Winnie, what has stood out for me is a very strong mental stability, emotional. I'm still going for therapy to date.
Okay.
It's been a fun year.
Oh wow, of therapy.
For therapy.
Yeah.
I'm doing therapy. Every Monday I'm doing for therapy. Different friends of mine pay for different therapies.
Oh, that's
so
really
I do, yeah. So the thing is, when you take care of God's children, God take care of you. So I'm taken care of by other people. So I do a lot of therapy. I read a lot, and I really drop people. Like me and you, we can be friends for 50 years, but for Nana to drop you, if you say one thing which irritates me, I'll drop there and then, and I don't look. I tell people off a lot, and I am a very, very strong person in saying no.
Okay.
And it has really helped me. I say a lot of and I stand out. Maybe I'm different. My personality is extremely different. I really stand out for myself. I walk away a lot. Lalit knows. I walk away a lot.
Okay.
I say a lot of no, and I tell people off a lot. And over the years also what I've learned, Winnie, is that you can't trust human beings. So for me, it is me and God. Okay. So I've also learned to keep very small circles.
Why is this? What happened? Is it?
What happened
to you? Say
it's because of the stigma, and also the people, the very close people who surrounded me. They have hurt me a lot, especially the friends. They have hurt me a lot. So I have a sanity to protect, man. Okay. You understand?
Okay.
And I also don't want to go back to being sick alone so that they get more things to talk about. Because you think it is only Rachel. You don't want to hear the things I'm told. And so Nana, them breasts you were so proud of, where are they? Oh yeah, they tell me that. And then men also say, but you can't date Nana, she doesn't have breasts. And they say, but you can't date her. Even one actually told me, not one, told me, but you said, Nana, why we fear you? What if you get sick again? What if someone marries you and you get sick again and you die and leave me here? It's a lot. I'm telling you, Winnie, there's nothing which I've not been. I've even been told by church people, you see why you got sick? Because you've really sinned around.
Wait, what?
Oh, yeah. And all these things. But you see, for now, I look at them, I'm like, but apparently, one or the other of these people, none of them hasn't been affected directly or indirectly. So I'm just like, be humble. So it is the stigma. I'm telling you the truth.
Yeah.
And even I think why most of people are losing hope is because of the stigma. I'm telling you the truth, Winnie.
Yeah.
With the exception of the cost of treatment and all this, you can imagine somebody who is so vulnerable being told those things to people tell me, Nana. But nowadays I'm like, okay. Okay, well,
you've developed a strong
I don't really care. So that is why I have to protect my territory. Yes. I have to protect me. I have to protect Nana. So to cancer patients out there, please protect yourself.
Yeah.
You only have you and yourself. Yeah. To the people who have been newly diagnosed, accept one, that you have a problem, a big problem. Let people talk and help you deal. Because you
not
need
just
the help.
Not helping. Yeah.
Number two, you have to believe that God heals and heals completely. Yeah. Number three, you have to know that you're in a war zone. You have to wake up every day knowing that it's like Israel and Iraq. If you're like this, you're dead. So you have to wake up and know you are fighting. You have to eat. You have to take medication. You have to go to the hospital, follow doctor's instructions. You have to change your diet because you can't have cancer and eat like Winnie.
Yeah.
No. Yeah. You have to change so many things.
Okay.
Yes.
And you see, Doc, what then do we need? Because it's beyond the illness, it's beyond the disease itself. It's all these other things that are surrounding you. Your immune system is compromised. Your mental health, is sort of like, because you have to deal with this heavy news that you have cancer, and you have to also prepare yourself for the treatment process, because like Nana says, this is you literally have to fight with every muscle, every being within you. And then the stigma to deal with. I don't know how else that we can fight the stigma because it's like the disease, there is treatment, you know, there are doctors to help with that, but then stigma, how do we fight
it? It's really an unfortunate situation.
Really
you know, you have cancer and top it all, you have unwanted things added to that, the stigma, lack of support, lack of finances, and so many other issues. So all this can be, you know, if society changes their mind, their way of thinking, definitely things should be better.
It would be better. It starts with us as an individual.
Absolutely.
Instead of pointing fingers and say, yeah, Nana doesn't have this, or Rachel doesn't have this. But how about just shift and say, how can I help Rachel? How can I help Nana? Okay, and not think that is just so sad to hear. I am really broken. Yeah.
You know, like, yeah, Nana, you are a survivor. How about you, Winnie, making it a purpose to ask me every day, Nana, how are you faring on? Because it is never the same again. Instead of telling her ati amenona, ati sijui nini nini, muulize, Lecho naweza kukupatia pesa ya matunda, 100 ya matunda. You know, why are we doing these people to others?
Yeah, we're really hurting
wrong.
People, and we don't know that what they're going through.
Exactly.
And that's why we're applauding you all really for coming by today, to just put a different face rather to cancer out there and say, hey, listen, instead of pointing fingers, instead of going behind people's backs and talking about the disease, how can we come together in support, right? Let's just start from there. Rachel, I am so heartbroken this one, I'm not gonna lie. I'm really heartbroken about all those things that are happening, but you're here today to share your story and say, hey, listen, yes, I might be going through this, but I'm strong enough to share my journey, ndio usaidia hata watu wengine. But for your treatment, right? So ulifanywa double mastectomy?
Ndio, kwa mwaka tofauti.
Oh, different years.
Ndio.
Yeah.
Kwanza nataka kuambia wala wako pale nje, sababu kuna watu wengi sana ambao wamepatikana na ugonjwa wa saratani. Na serikali huwa haisemi. Unajua ingekuwa vizuri kama tungekuwa tunaambiwa ripoti inatolewa watu kiasi fulani wamepatikana na ugonjwa wa saratani. Watu kiasi fulani wamekufa. Mimi ningeomba tu mwenye yako pale nje ajue kwamba akipatikana na ugonjwa wa saratani yeyote, akipata matibabu mapema atapona. Na pia wengi wetu tunapoteza maisha, wale wamepoteza maisha yao kwa sababu ya kukosa matibabu kulingana na vile daktari ametuagiza tufuatilie. Unakuta kama mfano breast cancer tunaendanga hospitali kuu ya Kenyatta, ni siku yetu ni ya Wednesday. Na unakuta kama daktari alikutuma uende upige picha ama ripoti yote yenye amekutuma uende ufanye ndio ukuje umuone, huwezi muona bila hiyo. Kwa sababu hata ukimuona bila hiyo hautasaidika. Unakuta sasa hizo nini hii mambo ya NHIF wakati ule tuko tunawekewa limit. Na bado upande wa SHA nimeona watu wengine wakisema kwamba ikiisha mtu anakaa mpaka angoje ile mwezi. Mimi nilikuwa naomba serikali kwa kuzuia maafa ya wengi wetu wasituwekee limit. Hata afadhali wa hiyo 500 hiyo kulingana na vile mtu alijaza, kuna ile kiwango ya pesa mtu ameambiwa atoe. Mimi nalipanga 4,995. Hiyo tuite ni ngiri 5. Afadhali turudishiwe ile kwa mwezi, kila mwezi. Hata kama tutaongezewa kitu kidogo juu, lakini na sisi tuondolee limit ati ya kuambiwa umeshapigwa picha moja, hii mwaka hautapigwa ingine. Sijui umeshafanywa surgery, ingine jisimamie. Hapo ni unakuta kanza inazambaa. Inaenda ikizambaa sababu haujafuatilia matibabu vizuri. But kama inaweza mtu afuatilie vile daktari amesema, kuna watu wengi ambao wamepona. Sasa kama mimi mfano, wakati nilipatikana kuna kitu imerudi hapa. Daktari wangu aliniagiza kutoka Kenyatta nitolewe hako kanyama, pali ka uvimbe kalikuwa, iende ipimwe, ionekane kama ni kanza. Nilikosa 15,000. Na nikakaa naenda kwa, by then ilikuwa NHIF. Naenda kwa NHIF naambiwa umeshatumia, ulitole wangu, ishatolewa sasa uwezi lipiwa hii mwezi. Ilienda hivyo mpaka ikaenda hapo nimepatikana bado niko na kanza. Unaona nilikuwa nimepoteza titi moja, nikakuja nikapoteza ile lingine. Kwa hivyo mimi naomba tu serikali yetu kwa heshima watuondolee hiyo kitu inaitwa limit, ati uwezi piga picha mbili. Yani hata sisi wakituongezea hata kama watasema tulipe hata kama ni 1,000 per month, lakini na sisi kama ni picha, kuona daktari, kutolewa damu juu, lazima ukienda daktari anakuambia utolewe damu. Hapo inaweza kuwa vizuri sana. Mimi nilianza matibabu yangu ya kwanza ya radiotherapy tarehe 30 mwezi wa 6. Huwa tunasahau sana. But kitu yenye ishawahi kukufanyikia si rahisi usahau. Ilikuwa tarehe 30 mwezi wa 6 2022. Hapo ndio nilipata chemotherapy yangu ya kwanza. Na nilikuwa napata after 21 days. Nilienda chemotherapy zote 8 ambapo nana anaelewa hiyo ya red vile inakuanga. Nilipata hizo za red 4 ndizo zinatungwanga nywele na kufanya tunakuwa weusi kila mahali. Na hizi zingine 4 zilikuwa majimaji. After kumaliza hiyo nilienda surgery. Lakini before niende surgery nilikuwa najifanya bado sijaelewa. Nashukuru sana Kenya, hata uwezi enda tu kupelekwa theater kama uja sign umeelewa chenye tumefunzwa. So tunafunzango tukiwa wengi. Ukisema umeelewa una sign. So mimi nilikuwa na zile za sijaelewa. Juu nisiende theater.
Delay.
Delay kwenda theater. Mtu mwingine akaniambia wewe ndio unafanya kanza Izambaye. So nilisema nimeelewa na nikasign. Ndio nikabukiwa. But nilizima simu December nikafanywa Januari. Nilifanywa surgery yangu ya kwanza Januari 2022. Na nikaandikiwa dawa inaitwa Letrozole. Unaona nikiongea nakauka midomo ni juu ya hizo madawa. Nikatumia hiyo dawa inaitwa Letrozole na kibahati mbaya nikakosa hiyo dawa. Nikaendelea tu kukaa without juu sasa nitafanyaje, na ilikuwa inatoka 1200. Ndio sasa uvimbe ikaanza kukuja, ikapatikana kengine kako hapa, nikatumwa PET scan ikaonyesha. So bahati mbaya, na hiyo nitaisema tu juu hivyo ili happen. Tunaambianga ukipigwa picha unarudi unaitishwa na daktari vitu zako zote zenye umekuwa ukifanya nini ukitibiwa nazo. Alafu ndio wana discuss. Wakikudiscuss wanakupigia simu. So mimi mwenye alinipigia simu after kumwachia hizo document, kulikuwa na daktari mkubwa na mdogo. So huyo daktari mdogo aliniambia kwamba tumeona kweli uko na kauvimbe hapa. Na kwa kauvimbe tumeona ni kama kanza inarudi. Hata hivyo tutakwambia pole ya bure, tutakuandikia dawa nyingine ambaye tutakuongezea juu ya hii. Lakini iko na madhara yake. Nikamuuliza madhara gani? Akasema nenda utafundishwa wapi? Uko mbele. Wale wamesoma washukuru wazazi wao sana. Kwa wale wamesoma. Maana ningekuwa nimesoma hiyo kitu, hata nilifikiria tu kama ningekuwa nimesoma hii imenifikisha hapa ingekuwa hivyo. So aliniandikia, simu ilikuja ikaingia, akaongea akamaliza, akatuma sijui ilikuwa message alifinya kwa muda. After kumaliza aliniandikia karatasi. Akaniambia nipeleke kwa recording. Kupeleka huko aliangaliwa akaniambia kuna dawa umeandikiwa. Nikarudishia daktari wangu huko chini wakaniambia the same. Na nikamuuliza kwa WhatsApp, Junior alinipigia. Umesema umeniandikia dawa umeniongezea, iko wapi? Na huko chini wamesema hakuna, hakunijibu. So mimi nikapuza tu nikasema pengine ni mimi sikuelewa venye alikuwa ananiambia, nikawacha hivyo. So wakati niliambiwa naenda surgery kutolewa hiti tingine, nilimkuta huyo msichana na daktari mkuu. Nikamwambia nakumbuka ukiniambia kwamba mtaniongezea dawa hamtanipea pole ya bure. Wakarudi kwa faili yangu, wakaangalia. Na daktari huyo mwingine nikasikia akisema first priority kwenda theater, mimi nipatiwe first priority. Lakini huyo hakuongea, but huyo daktari mwingine mimi sielewi Kisungu yenye waliongea. So mimi nataka kusema kwa wale ambao wanafanya kazi ambaye inajali maisha ya mwanadamu, wakuwe makini sana. Kwa sababu hizi simu kusema ukweli zinafanya kama mimi kwangu ili ni mess. So mkitibiwa mapema na mfuatilia matibabu ya daktari vile ameandika, mtu hupona. Mtu hupona.
Thanks, Rachel. Yeah, we're due on a break and nastaki kukuharakisha. Can we go for break and and then you will send you? Okay. And also the question that we're asking you this morning is if you could send one message to every man or woman out there about breast health, what would it be? Can we take like 2 or 3 feedback on WhatsApp and then we go on a break, Philip? If that's possible, good. Okay, all right. So this one says, kindly ask doctor to explain why HER2 positive patient do not get any other treatment after completing the treatment plan of chemo, surgery, immunotherapy. Okay, and then another person here says, wearing a bra while sleeping or using deodorant, does it cause breast cancer? Okay, that's a question for you, doc. And then this one says, hi, good morning. I'm Carol, a breast cancer survivor, maybe, or patient, we don't know, and says, nimefanya chemotherapy and operation, haki sai nimekosa pesa ya kufanya radiotherapy, please help me. Nilifanyiwa operation, mwezi wa saba, date 23rd, okay? And then this one says, good morning, two ladies today are very powerful and joyful despite all they have gone through. They are a great encouragement. May the Lord win their battle against cancer for them. Oh, amen to that. And then this one says, I'm Beatrice, currently done with radiation, but me is rectal cancer. Main challenge is financial constraint. Okay. And then do we have another one? Or are we due on a break? Okay, probably let's take a break, and then when we come back, we'll answer all that. Doc, I hope you can remember some of them. And also the question that I'd want you to answer is that how can, say, institutions like hospitals, medical facilities also come in to support? Are there probably plans, and especially for RFH, to help patients who cannot afford? Because even from the comments, what we're getting is people are saying the cost is expensive. Hatuwezi afford. What can be done? All right, so all that is coming up after the break. Do stay with us. There's so much to discuss on the other side. Do stay with us. The show is Your World. Welcome back. Welcome back. 32 minutes past the hour. The conversation today is on breast cancer. And even as we mark the beginning of Breast Cancer Awareness Month, which happens in October. And the theme, like we said, is every story is unique and every journey matters. And we have two powerful ladies here with us today, together with Dr. Lalit, to come and really, first of all, change the face as far as cancer is concerned, because they're speaking truth to power, that there's so much that needs to be done right here in the country as far as screening, diagnosis, and treatment is concerned, and even largely when it comes to support for breast cancer patients and survivors as well. And we're trying to see how can we kick stigma out of the picture when we're talking about breast cancer, because it is our collective responsibility to support one another, and most of all when it comes to breast cancer. And the question that we're asking you this morning is, what is that one message, or if you could send one message to every man or woman out there about breast cancer, what would it be? If you could send one message to every man or woman out there about breast cancer, what would it be? I'll be looking at your feedback in just a second, but Doc, there's so many questions for you. Will you remember?
Yes.
Oh, great. Okay.
So there's one question, somebody asking about HER2 positive breast cancer. So once they have finished the treatment, surgery, chemotherapy, radiotherapy, why they are not given Herceptin? Actually, patients who are HER2 positive, most of the time they require 1 year of the Herceptin treatment. It comes to almost 17 to 18 cycles of the injection given every 21 days.
Okay.
So for HER2 positive disease, we give. Okay. Second question was somebody asking about wearing bra at night and deodorant use and risk of breast cancer. Absolutely no association whatsoever. Okay. So there is no link whatsoever.
Those are some of
and other questions where I think some concerns regarding high cost of treatment, which is, you know, when it comes to any discussion with a cancer patient, the deciding factor always comes down to finances. You know, what insurance they have, how much is a cover, whether they have insurance or not in the first place. So it becomes very challenging because we need to, you know, tailor the treatment as per the patient's finances. Because we cannot advise some treatment that can, you know, financially ruin a patient and a family. So we need to take that in mind. And as Nana said, getting SHA at the basic would be very, very useful, you know, because it has a very decent cover for cancer treatment. So I think just pay the premium, you know, it's better you have some cover rather than nothing at all.
Than not have any cover at all.
It's very important.
When you say you tailor-make the sort of like treatment to the patient's finances or the financial situation, the first concern was for me is, does that then impact on the quality of care that they receive?
It can affect the treatment that we decide, because, you know, we cannot do the best possible treatment if finances are limited, you know. Like somebody is HER2 positive, like the patient who was, the Herceptin injection is quite expensive compared to chemotherapy. And if you're going to do chemotherapy along with Herceptin for so many cycles, you can imagine the cost, you know. Similarly, based on, you know, few parameters in the biopsy and other findings, the treatment can change. Also, if a woman has a relapse, you know, then she requires a new treatment again with newer medicines, which can be more expensive. And what happens if a woman has, you know, some side effect, or she requires some admission for a few days for supportive care? That's another very costly affair.
All right. I think that is where then my question on then, are there provisions for, say, different facilities to come in and support, say, patients who are not able to afford either the complete cost of care or can't even access, care at all? But before that, Nana, you had something to add on to Rachel's?
I wanted to add something on about the SHA issue, because then we have a lot of problem just before the cancer patients start assessing or benefiting from the SHA itself. There is a staging, there is the process of the biopsy and the diagnostics. You see now, let's say in a public hospital like KU or Kenyatta, and just a normal simple biopsy, they have to pay for. In fact, let me read this. One of the biggest drivers of late presentation for cancer diagnosis and treatment in Kenya is the cost of diagnostics. While SHA covers most of the cost, the cash top-ups that patients are required to pay are prohibitive for many. For instance, a patient with large mass must pay 27,100 in a public hospital cash to be fully diagnosed, to do biopsy, histology, immunohistology, chemistry, IHC, and staging CT scans. Can you imagine, Winnie, how many Kenyans are able to do this? So if the government could slightly adjust SHA for cancer patients to cover from diagnostics, biopsy to treatment. And then they also need to remove this thing of limits. What are they talking about limits? How much can, I don't know now if it is 300,000, if it is 550, you don't even know. How much can that treat cancer with, sincerely speaking? People are really suffering out here. You've seen the pictures I've shown you. Those people, they come to us when it is too late. What can we do with these people? These people will definitely die. You can only take them for wound care, because if I take such a patient to Lalit, he will be so honest as an oncologist and say, you know what, Nana, there are so many years told me, this one, take home, just do wound care, give them food, let them die a decent death. We can't continue doing this. Is 21st century. So really, I know SHA is a real breaker, and I say that, but we need a lot of adjustment. And you know what, Winnie? The problem is not that the government doesn't know this problem. They know. But what are all these bodies? The National Cancer Institute, NCPB, all these bodies, what are they doing about it? The Ministry of Health. How many people are we going to lose in between here? Really, how many?
Well, there was a time, I had a, sorry, Nana, those just reminded me of a conversation we had some time, but say like 3 years or 2 years back. And this lady was talking about, so she was told to go to, say, KNH, and just for diagnosis and biopsy, she was told to wait for a year. So there's a backlog, there's a long list of people who are waiting to even just get biopsy. So you can imagine the progression, part of it. So clearly there's so much that needs to be done. I think probably like in the next conversation, we need to have all these officials, say from the Ministry of Health, and to just come and help answer some of these questions.
You know the problem we're having, Winnie? It's too much talking and paperwork with no execution. That is where we are missing the point. I'm telling you the truth. We need to work and do things which are work. Actually, I am here with no fear of contradiction to tell our government the strategy is not working. Go back to the drawing board. It is not. Cancer is beating us left and right. We need a lot of awareness on early dictation, why people need to go for medical checkup, on diet, on all these things. We need help, and this has to start with the government on private sector and government facilities. Let's say like Nairobi West, we have a Wanjiko package. If you have cancer and you have all these struggles, please come. You are going to, don't stay at home sick. Come, there's a Wanjiko package. Government pay this and you are going to top up this. And I'm very sure even Lalit and other facilities, everyone wants to help. But you see, the biggest help will come from the
government. Yeah. And this I mean, listen, it's just the first day of October. We have the entire month to really push, you know, for change. And because, like you said, it is not working. We need to go back to the drawing board and figure out, you know, what will work so that we help as many patients out there. Some of them probably who are watching us this morning and they're like, we don't even know where to go. Dr. Lalit, I'll come back to you to then understand from, say, RFH, do we have those provisions? And from where you sit as an oncologist, what needs to change as soon as now so that we help as many patients out there as we can who are dealing with any type of cancer? Just make it a little bit easier for them when it comes to their pocket and access to care. But Rachel, so double mastectomy, you're still going through treatment, right? Just this morning umekuja from radiotherapy. But how are you? Unaendelea? What is happening, you know, with you? Even how can people support? Because like you said, ulihama ile place ulikuwa unaishi kwa sababu ya stigma, ukaenda place ingine, bado unasumbuliwa.
Bado kuna stigma. Alafu mimi kwanza naomba serikali yetu kwa heshima. Kenyatta ni hospitali kubwa ambayo iko hapa Kenya na mimi matibabu yangu nafanyia pale Kenyatta. Kwanza naheshimu madaktari wote ambao wanatibu ugonjwa wa saratani. Kenyatta mashini imeharibika. Na ndipo za tutoke pale tulipewa, na nashukuru madaktari kwa kutupatia hiyo rifaru. Na tukaweza kwenda the Nairobi Hospital, hapo ndio nimetoka asubuhi. Lakini nilikuwa naomba serikali kama inaweza, tafadhali wanunue mashini ya radiotherapy hata kama ni 3. Kwa sababu tukiwa pale ukiangalia kama pesa zenye tunawekewa kwa hiyo akaunti ya SHA haiwezi toshea matibabu yetu yote. Unaona? Na bado pale Kenyatta kama tungetibiwa pale Kenyatta hakuna kitu tungeongezea. Lakini tukienda nje lazima tunaongezea kitu kidogo. So kama wangekubali kwanza watusaidie na mashine, wanunue mashine hata kama ni karibu 3, tunaweza tukashukuru sana. Na hatuna bado nini ya PET scan. Kenyatta hakuna picha ya PET scan, nini mashine ya kupiga hiyo PET scan. Nikirudi nyuma kidogo, mimi mwenyewe wakati nimefanywa hii matiti ingine nimetolewa last year tarehe 9 mwezi wa pili. Ndio. Na nilitolewa hapa hivi kale kitu kalikuwa kamefura. Unaona mkono wangu huwezi kunjuka. Kalikuwa kamefura hapa. Hii mkono imetolewa kwa hapa, sina kwa hapa. Sina njegeke. Hii ingine ndio iko nayo. Njegeke ile unashika unacheka. Ni hapa hivi nyama ya hapa. Hii hakuna. Haya sasa kuna hii nini? Kuna hii pipe yenye tunawekanga hapa.
Imefura ukicompare na
imefura. Kuna ile pipe tunaingishwa na kitu kingine tunabeba hivi ka drainage kadogo. So mimi nilikuwa nimekuwa saidi last year. Nilikuwa nakaa hivi. Unaona kama ile kuku imelalia mayai inakaanga na mabawa yake hivi. Nilikuwa nakaa kama kuku imelalia mayai. Sababu gani? Juu pande hii niko na mpira, pande hii niko na mpira. Akaka kitu nakalea kama mtoto, hata uende kwa choo, hata uende wapi uko nako. So ni 14 days peke yake, 2 weeks. Ni 14 days peke yake. Nilikuwa nasikia ni kama mwaka. Kuna madam moja anaitwa Rebecca Moses. Rebecca Moses anahitaji kutolewa hizo vitu zake ni za huku nyuma. Hata ukiniambia kazi yake ni ya wapi sijui. Ameweka kibandiko moja, akona pipe pande hii, akona pipe pande hii hapa kwa mgongo. Zinakuja zinakutana wapi? Kwa karatasi. I think ni makojo zinatolea hapo. Si kuweza kutaka kufuatilia sana. But Rebecca Moses wakati tumeongeongea na yeye ananiambia hizo vitu ameshapona. Kulingana na daktari wake ameshapona. Ni pesa amekosa ya kutolewa hizi vitu. Nikajiuliza aje, mimi mpaka nililia machozi. Machozi yangu inakuanga hapa. Nikajiuliza aje, kama mimi mwenyewe nilikuwa nimewekwa pande hii na pande hii na ni hapa mbele. Nikakaa tu siku 14 juu sasa unajua hiyo drainage daktari akiangalia anaona kunatoa uchafu na mbiango rudi. Yangu Mungu alisaidia sikurudishwa. Nikatolewa. Ilikuwa imenishinda nikasikia ni kama mwaka, hata mtu anatolea yangu anasikia amepumzika. Sasa na huyu dada mwenye ameko pande hii akona pipe imekuja hapa, side nyingine imekuja hapa. Nikamuuliza akaniambia anaitishwa 450 kutoa. Na sasa inamlipia 50. Nikirudi nyuma mimi mwenyewe after hii radiotherapy nafanywa naenda kuwekwa chemotherapy. Na mnaona nilimaliza chemotherapy mwezi wa 5 date 27. Nilianza January date 20. Sasa mimi mishipa yangu yote imefungana. Daktari wangu alikuwa amerequest niwekwe hiyo chemopot. Nikitembea penye nilikuwa natembea kwa hospitali nakuta ni 120, ingine ni 150. Ukirequest kama SHA itakulipia, inasema italipa only 15,000. Zingine nijitafutie. That's why umesikia nikisema kama serikali yetu inaweza kukubali ituongezee, tuko tunalipa kwa NHIF 500, ituongezee hata ifike 1,000 hiyo per month. Naye mtu akienda kutolewa kitu kama ni hiyo kufanywa surgery inalipa yote. Kama ni kutolewa sasa kitu kama hiyo mwanadada inatoa yote. Tunaweza tukashukuru sana kwa sababu tunateseka, tunahangaika na sauti yetu hata tukitoa hatuonangi kama imeenda mbali. Mimi ningetaka kuongea na waziri wetu mpendwa Enda Duale. Ajaribu atushughulikie. Lingine ni hii ati pesa za mtu zimefika mwisho. Nilikuwa naomba government kama wanaweza wakafanya kitu ingine tofauti na hiyo. Ikifika mwisho inakuwa watuambie ikifika mwisho mtakuwa mnatopa hapo pesa kiasi fulani, inaendelea. Dhani mwingine anaitwa Paul alikuwa anadungwa shindani ya 52,000. Naye alienda akakuta nini yake imefika mwisho, so anaambiwa ngoje sijui mpaka mwezi gani ndio sasa ataenda kufanya nini. Hapo ndio unakuta kanza imeanza kufanya nini, kuzambaa. Kwa daktari akipanga matibabu day one yenye unaambiwa uko na kanza, unaambianga utapigiwa tena simu. Nashukuru sana madaktari huwa hawatuchochi. Wanakupeanga list yako, utafanya hivi, utafanya hivi, utafanya hivi. Kama mimi niliambiwa leo utafanya radiotherapy 8, ine ya red, ine si ya red. Ukimaliza hapo utaenda surgery, ukimaliza hapo utafanya radiotherapy 15, ukimaliza pale kuna dawa utakuwa una meza. Unaona kila mtu anajua venye kutakuwa. So kama serikali inaweza ikaondoa tu hii ati pesa zimeisha, mtu akae nyumbani, wakae wakijua hii kitu inazambaa, watufanyie jambo tofauti na kukaa nyumbani. Hata kama watasema tafuta pesa ya 1 month, ya 1 year top up, iendelee kuliko ati stop ingoje mpaka ile mwezi inaweza kuwa vizuri. Watujali.
Asante sana. And clearly, listen, there's so much that we can talk about, and it's just the start of the month, so we can dedicate the entire month to really just talk about the different facets about breast cancer, from diagnosis, treatment, screening, and all those things, so that we really find a solution. But Doc, can we go through some of the questions, and then I'll come back to you to answer the question of the facility and what we can do. And the question that we're asking you today is, what is that one message that you would send either to every man or woman as far as breast health is concerned, but also the question that you have for Dr. or for Nana or for Rachel as well, keep sending them on our way, and that is our WhatsApp number 0112 500 400. Give us a call, although we're like, we have less than 10 minutes before we end the show. But let's go through this one. So this one says, Your World, NTV. I have a question. So I'm a mom of 3, but every time wakati wa breastfeeding period, kuna vidonda kwa nipples. Zinafura hadi siwezi breastfeed. It usually starts 3 to 4 months after giving birth. Nikiacha kunyonyesha inapona kabisa, so mi huachisha mtoto kunyonya akiwa 4 months. Nilienda hospitali nikaambiwa nitumie paracetamol. Some people say ni breast cancer, but if it is, mbona inapona after kuachisha mtoto kunyonya? Personally, naogopa tu kuambiwa ni cancer, walai. So wait, so this mom of 3, every time they're breastfeeding, doc, this is for you. She has like, what is it called? Vidondas. What are they? Wounds, yes, on the nipples, and the wounds swell that they cannot breastfeed. So, and usually starts after 3 to 4 months after giving birth. So she stops breastfeeding the babies after 3 to 4 months.
Because of baby's dentition or something. Nothing to do with breast cancer.
Nothing to do with breast cancer, because she says that she's scared that, she'll be told. So it has nothing to do with breast cancer.
But she has to continue her screening.
Okay.
As per her age, that's very important.
Okay. Go for screening has nothing to do with breast cancer, but just screen.
Screening
just
is the most important thing.
Okay. Yeah. Thanks, Doc. Okay. And then another one says, we are what we eat. Statement is very true. Avoid wheat products, dairy products, and sugar immediately and completely. I think this is Jane, cancer survivor, from the question that we're asking you. What one message would you send to every man or woman as far as breast cancer is concerned? This one says, Beatrice currently done with radiation, but me is rectal cancer. Main challenge is financial constraint. As doctor, does sugar, wheat products, and dairy products cause cancer? And if you have cancer, should you stop taking them?
So diet and cancer are, a very important topic. So these days, obesity and, high BMI is linked to various cancers, including breast cancer. And why this is happening? Because of lack of physical activity and heavy consumption of processed food. Okay, high, everything is processed. Whatever you buy in supermarket, most of them would be processed.
Processed food, yeah.
High consumption of carbonated beverages. They contain high sugar, nothing but sugar. I think one can of Coke would have around 7 to 8 spoons of sugar. So, and one should remember, apart from the risk of cancer, they increase the risk of hypertension, diabetes, and heart disease, which is an equally important killer in the world, not only in Kenya, throughout the world. Cardiovascular disease,
Yes.
undiagnosed, hyperlipidemia. So all that is linked. Coming to diet in a patient already having cancer. It depends on individual choice. There is no specific intervention that I would recommend anybody. Just continue whatever has been made at home. Cut down on processed food, high sugar. Have some activity. That's very important.
Yeah.
Maintain your body mass index.
Yes.
Very, very important.
It's very important.
Yeah.
Okay. Listen, we have 3 minutes before we say goodbye to Malize show.
I also have a question for
You have a question for Doc. Okay, can I take that as your parting shot? Like,
Yes.
Ulize Swali,
Yes.
and then do 10 seconds of your parting shot.
Is cancer, is stress anywhere related with cancer, really? Yes, stress, because from analysis, especially women, women who have had cancer, they have really life-boggling issues. Is it cancer related to stress? Please tell us. Then the parting shot. Please go for medical checkup.
Okay.
That is all I'll say.
Yeah.
Go for medical checkup. The free medication is walking, eating well, sleeping. It is in the food that we eat.
Yeah.
Please
Better
walk,
what to
guys,
eat.
and
Yeah.
take water.
Yeah. Hydrate. It's important. Okay, thanks so much, Nana. And Doctor, answer her question.
Yeah, that's very important. What she said, what she said, all free, you just walk as much as possible daily, have a good balanced diet, more of fruits and vegetables, less processed food, less of, red meat, no smoking and tobacco, alcohol consumption, because even one drink is, risk factor for developing cancer, even one drink. So the WHO mentions that stop completely.
Not reduce,
and tobacco in any form. So these are all avoidable. You can avoid the risk of developing cancer and other equally important health issues just by following simple steps. And last thing I would say, please get screened.
Okay. We have a question for you. We have a question for you, actually, Doc. So the question is, why are cancer patients given chicken before chemotherapy?
There's nothing. Maybe it's a fact that it has a high protein thing, which is good for cancer patients because they might lose weight while on treatment. So chicken is a safe way to give a high protein diet.
Good.
Yeah.
Okay. All right. Thanks so much, Doc. Oh, wait. The question on your facility, do you have provisions where if someone
So
cannot
at
afford
my
to?
facility where I work, which is RFH Cancer Center, which is located at Ruai, we have the state-of-art cancer center. We have the state-of-art PET-CT and SPECT-CT where we, use for managing cancer patients. We have the latest radiotherapy equipment which has now commissioned. We have brachytherapy, and I'm a medical.
You have brachytherapy?
We have brachytherapy also.
Okay.
And our radiotherapy also started. I'm a medical oncologist. I do chemotherapy. My colleague, Dr. Helena, she's a radiation oncologist. She's full-time. And then we have something called lutetium therapy, which is used for advanced prostate cancer. It's a nuclear medicine treatment used for prostate cancer.
Okay.
And we run screening throughout the year. It's not that only October we are going to do screening. And my suggestion is October month is okay, but we should have passed on the message throughout the year.
Absolutely.
And it is never, too late to get screened. As per your age and sex, get screened for breast, cervical, and prostate cancer.
I see.
Thanks,
you. Doc. And clearly, we need more time to discuss this. So promise to come back again, please. Yeah, to continue with this. Okay, Nana. So, Rachel. So kuleuko sahi. What is it that you'd like to tell the people while you're not watch sahi, and probably they're like, I don't know where to go. Ata sijui nitaongea na nani, as far as treatment is concerned. And for someone who say,
Hebu sema na lugha ya taifa nikushike vizuri ndio nijibu kitu ambaye sitakonfuse mtu.
Okay, so this swali mbili, right?
Ndiyo.
So ya kwanza ni ule mtu anatutazama na anashangaa maybe ameambiwa kona cancer na hajui afanye nini, aongee na nani. And then the second part ni ule mtu hana cancer. And wewe umepitia hii journey up until kule huko sahi, what is it that you'd like to tell that person? Tutamwambia nini?
Mimi nataka kuambia yule mtu ambaye hajapatikana na ugonjwa wa saratani ashukuru Mungu sana na ambie Mungu asante. na asidharau wale ambao wako na huo ugonjwa, manake huwa tunajipata tu. Na kwa yule ambaye amepatikana na ugonjwa wa saratani, ajue ugonjwa wa saratani sio hukumu ya kifo. Kansa sio hukumu ya kifo. Mtu akitiritiwa mapema huwa anapona. Yeah. Lingine nataka kurudishia na madaktari wote wa ambao wanatutibu kansa. Huyu amemention daktari wangu Dr. Helena, ndiye alikuwa ananipatia chemotherapy kule Kijabi. Nashukuru sana. Nashukuru madaktari wote ambao wamesimamia sekta ya kansa. Na sana sana wale ambao kwa sasa wananifanya radiotherapy. Nashukuru Dr. Deno, Dr. Joseph pale the Nairobi Hospital. Thank you so much. Tunarauka asubuhi sana, tunakuja na tunafanywa na tunarudi home. Na Dr. Rarik amesema kwamba pale Roy Family wameleta mashini bado ya radiotherapy. Kumaanisha wale ambao tumepatikana na ugonjwa wa saratani na tumefika wakati kiwango cha kwenda kufanywa hiyo matibabu ya ugonjwa wa saratani, vile mashini yetu Kenyatta imeharibika, at least tunaweza kupata mali pa kujigawanyisha. Huyu aende huku, huyu aende huku, na sisi watatufanya nini? Tuweze kutibiwa. Cha muhimu ni tutibiwe tupone.
Absolutely. Very well said. Asante sana Rachel, and please mkuje tena because ndo tumeanza you know the month. So and we dedicate hii month yote kuongea juu ya cancer every single Wednesday here on Your World. So yeah, tafadhali mkuje tena so that we continue to push. Ndio.
Mkiniita niko available. Na wafundishanga, by the way nawafunza kwa mtandao kwa TikTok.
Oh, that's nice.
Na nimerescue kwa wale kama uko hapo nilikurescue. Unaweza kaandika hapo comment kidogo. Hata akasema ni ukweli. Nimerescue wasichana wetu wengi sana ambao wako nje. Wakati na kwa mtandao unasikia mtu ananiambia na asking for my friend. Ati sijui hivyo. Ati I'm asking for my friend. Nikimjibu unakuta inbox kumejaa. Ni mimi niliongea na wewe hivi na hivi na hivi. Alafu ananiambia ni yeye mwenyewe. So namwambia juu kitu ni kitu ambayo inakaa sana. Ikikaa sana utatibiwa vizuri. Harakisha ukuje Kenya ama uanze huko. Na wengi wameanza.
Oh, that's really nice. Asante sana Rachel. Lazima tumeambiwa tuondoke, but again we'll continue with the conversation. Rachel Nyokabi Kariuki, breast cancer patient, aka
Rachel K cancer patient pale TikTok. Okay. And
Dr. Lalit, thank you so much, as well as Nana as well. Asanteni sana. We'll continue with the conversations right here on Your World on Wednesdays as we dedicate the entire month to Breast Cancer Awareness Month. But for now, allow us to say goodbye. My name is Winnie Lubembe. Enjoy the rest of your day. See you tomorrow.